just had her baby, and she's going through the same panics that every new mom has. Are they crying too much? Are they getting enough food? And what's the deal with this umbilical cord? So right now we're calming your fears with the help of the author of The Happiest Baby on the Block, pediatrician Harvey Karp. Welcome to the show. Okay, when we talk about newborns, new babies, it's like 0 to 8 months, right, that we're looking at. The first concern is...
2 months. Well,
8 weeks, I'm sorry, 8 weeks to the 2 months. First thing we're looking at is the face, the baby's face. When do you have to be concerned about the way they look?
Oh, well, they're so cute. But, you know, we don't have a lot of... you need more training to get a driver's license, but to have a new baby, so it's not uncommon that parents are a little bit confused about what to worry about. For example, the chin. All babies have tiny chins when they're born, and a lot of babies have little rashes that come and go. But that's normal. No, just completely normal. And then the soft spot. Everybody's always worried about touching the soft spot, but that's covered by skin that's as tough as leather. So babies are very well protected there.
Okay. Well, another thing that seems to stress parents out, I guess, is the umbilical cord. When the baby comes out, a piece is still attached when you take the baby home.
It looks so gross.
And it would freaks me out a little.
But you know, this is really tenacious. I mean, it's strong, and there's no pain there. You cut it with the scissors, and it doesn't hurt.
So they don't feel it at all?
No. It's kind of like the hair. You can move it around. Don't yank it. But you can move it around, and then you squeeze a little alcohol. So this is not to worry about. But you do want to be a little worried if it starts getting red and inflamed. If it starts getting redness on the normal skin around the belly button, then you've got to call your doctor.
Is there a difference between an insy and an outsy?
No, but I'll tell you this. People say it falls off, but it really rots off. It gets kind of bloody and a little bit gross after a week or two.
The last time you were here, we had such a response because you gave techniques for stopping a baby from crying. You called them the 5 S's. Swaddle, side or stomach position, shushing the baby.
Which you can use on an airplane, by the way, too.
There you go, shushing, swinging, and sucking. Now, when is it dangerous? When is a baby really crying too much? How do you know when it's too much?
Well, you don't worry when you can calm the baby easily with feeding, of course, and when the baby calms down with these 5 S's. And actually, we just launched a program where we're teaching people around the country, at hospitals around the country, how to do the 5 S's. If the baby calms down with those simple techniques, there's no need to worry. But you would worry if the baby doesn't calm down with feeding and doing the 5 S's. And of course, if there are other signs of illness, like if the baby is lethargic or has a fever.
So in that case, call the doctor.
Absolutely.
Okay.
Right. It was someone told me that Tim, Elizabeth's husband, was shushing in the baby's ear like you told him to do.
Oh, yeah? Oh, good.
Like in the baby's ear.
Well, that's a good thing.
See, I would find that annoying if I was a baby.
I know, you said that. Well, you would not like to live in a uterus, because it's like that 24/7. It's that all the time.
What about babies getting dehydrated? Moms seem to be worried about that,
You know,
too.
dehydration, it's something that you worry it's the baby getting enough milk, but it's super easy to check for dehydration. So you don't worry if the baby is peeing a lot. Well, first thing is check inside the mouth. If it's wet and slippery inside, the baby is fine. If the baby is peeing a lot, the baby is fine. But you would worry if the urine has pink spots in it, or if it's concentrated, if it's dark yellow. That's a sign that... Well, but here you go. Just put a finger in the mouth. If it's slippery and wet in the mouth, then the baby's doing well.
What about circumcision? A lot of parents choose to circumcise their sons. Is there a point where you have something you need to look for to see if it's healing properly?
Well, the weird thing that is normal is that the day or two after circumcision, there's like this yellowy, wet scab on the penis, and that people think it's pus, but it's really not. But what you would worry about is if there's redness and swelling that's spreading down the shaft of the penis, or if it's still painful after 48 hours. Because usually by 48 hours, even if you touch the end of the penis, it doesn't hurt them anymore.
What do you think about that? What do you think about circumcision?
I think whatever you decide, it's the wrong decision. Because on the one hand, if you do it, you go, oh my God, they're in pain afterwards. It's barbaric on the one hand.
At the breast or in the hospital, they cry when they get their little pee-pees
But I've seen kids who didn't.
It's wrong.
I've seen
boys' pee-pees were cut.
They cry though.
But I've seen a bunch of boys also who needed circumcisions later on, and when they're older, they cry even more.
Oh, that's got to hurt. That's got to hurt.
A lot of moms worry that their baby isn't peeing or pooping enough, or how do you know? How can you tell?
Well, normally it's peeing 6 times a day, and they poop 2 to 6 times a day. But I tell you something, breastfed babies, breast milk is great, and one of the reasons breast milk is so great is because it goes through their system. It's so well digested, and sometimes they get this yellow diarrhea, but it gets rid of the bad bacteria. That's why their poop kind of has a sweet smell to it. It doesn't have a bad smell. So breastfeeding is terrific, but if a baby is going...
sweet, having...
No, breastfed babies, literally, they don't have the bad bacteria in it.
Okay.
But if they're skipping more than 24 hours, again, with breastfed babies, that may be normal, but it's always good to check with your doctor if that's the case. And of course, if the urine is dark yellow and strong smelling.
That's not good.
The other thing is fevers with babies, because sometimes one of my kids had spiked high fevers. At what point do you not have to worry about a fever, or do you always worry?
Well, again, we're talking about the first 2 months, and in the first 2 months, a fever is different than in an older child. It's anything over 100.5. If the baby's under 100.5 and is acting well, then you don't worry.
Okay.
However, if the temperature is over 100.5, you call the doctor, because in the first 2 months, babies are fragile. You don't want to make a mistake. And so, especially if they're skipping 6 hours or they're lethargic, but even if they're acting great, if the temperature is over 100.5, it's always good to call the doctor.
What's the best advice you would give to a new parent like Elizabeth?
Be patient with yourself and know that it takes time. Nobody knows this automatically. And to remember, like I said the last time, that for those first 3 months, you're kind of like imitating the uterus. So lots of holding. You can't spoil a little baby, so she doesn't need to worry about that.
Okay, just hold them and love them.
And don't lay them on their stomachs anymore, right? On their backs?
Sleeping is only on the back.
On the back.
Only on the back.
That changed from years ago.
Yeah.
All right, our thanks to Dr. Harvey Karp. Everybody in the studio audience is going home with a copy of Dr. Karp's DVD, The Happiest Toddler in the World. We'll be right back.